Hey everyone, welcome to another episode of That Naturopathic Podcast. Just going to be a quick clinical bite again today. It's Dr. Dave, and I want to talk about something that I use quite frequently, and that is demulcents. Demulcents are, like I may have told you in the past, are part of my grandma medicines. So top three probably are demulcents, fiber, and bitters, and they are critical cornerstone piece to a lot of people getting well. Um, Maybe the first thing to understand with demulcents is sort of the word origin. The word origin means to caress. So what do? They basically soothe the tubes, right? So any tissue that they come into contact with, they're going to soothe. They have a kind of emollient or soothing action. So most directly, you would think about the tubes of the gastrointestinal tract, but sometimes these demulcents are actually also helpful for other tissues that you may not think of, and that would be maybe the lungs. They can be very helpful, and as I've talked about in the past, the bladder, another hollow tube that they seem to have an emollient or demulcent effect on. So it just soothes irritated tissues. Remember, the demulcent word comes from the Latin, which means to caress. So their nature is very yin. So they've got that sort of more feminine aspect to them. They're just going to hug and soothe and caress the tissues and make them feel comfy. Now, they could be inflamed for whatever reason. It doesn't really matter in a way, right? So when tissues are inflamed, you just need to calm them down to some degree. So they may not be the resolution of the problem. They may not be, the thing that fixes the deepest root cause of what's going on, but they're very often part of the initial calming down of the fire, calming down of the irritation. Another good example would be, if the stomach is just so irritated, if you don't soothe the stomach, then you're going to have a tough time ingesting, all the other foods that you need to ingest to rebuild yourself. And some foods are, they're worth it to break them down, but it might be hard on the stomach. So you give the stomach a bit of a break with the emollient effect of the demulcent, and then you're able to get the stomach to a state that it can it can digest and absorb all the other things that you need to get well. So one thing to know about demulcents is you can usually start with them. They're being as they're very yin. Let's look at bitters as a more of a yang sort of intervention. If your stomach is in a bad way, it's very irritable. You can't eat too many things. You can only have sort of bland foods. Or you're highly reactive. I do find reactivity and the stomach proper to be related. So, that's very limiting. And even in terms of bitters, maybe you don't want to take bitters because they may actually increase the irritation on the stomach, because the bitters have a kind of effect of like, hey, come on, get it together. Like they have a bit of a stimulating effect, but it requires the stomach to respond. And if they're already irritable, then it's not probably the right way to go about it. You might want to use a demulcent first. Maybe a good example or comparison would be sort of, you don't want to work out when you're absolutely exhausted and sore from working out 2 hours before. You need some yin time. You need some, like, glutamine and rest and nutrition, and then you can go work out another time. So that same sort of concept may apply to the yin and yang of bitters and to demulcents. Just give the soothe first. If you've had a rough, say someone's gone through something traumatic, and they come home and they've gone through this trauma, you don't give them shit for getting into that situation and say, "Oh, next time you got to do this," or "you should have done this," or now we got to do grit training, or resilience training. No, you just give them a hug. Say, "Here's some soup. Here's a blanket. Here's a hot water bottle. Let me give you a hug. Just lay down." That's kind of the same idea. Just give your tissues a rest, often before demanding more of them, which may be why the order of demulcents to bitters makes sense in many cases. What are the most common demulcents? I'd say DGL, which is deglycerinated licorice, slippery elm, aloe vera gel, marshmallow. Probably I use them in that order of frequency. When I'm trying to address the upper GI structures, so we're talking about the stomach, the throat, the upper GI of like the duodenum, I'm probably going to use lozenges because they break down and start soothing everything they come into contact with, right? Because if you swallow a capsule, it's not going to start working until it gets broken down in the stomach. So the higher up something is, the more I prefer some sort of dissolving carrier, whether it's a lozenge or chewable or whatever. That makes more sense. Now, when you're addressing the lower GI, say there's something like a bowel condition, like not IBS but IBD, more like a more inflammatory bowel disease condition. So we're talking about Crohn's, colitis. In that case, you could maybe use something like a capsule. Most commonly, I would use slippery elm, and that can be very, very soothing. Right? It's not going to get to the core of the issue, but it's just part of, multifaceted approach to proper resolution of the problem, and also symptom management. Now, I will say some people, this is surprising to me, but some people find slippery elm tincture works fine as a demulcent. I talked to a sort of naturopathic herbalist friend of mine, and he probably wouldn't use it that way. But apparently in real practice, it works. I think there's one by St. Francis Herbs, slippery elm, that I've heard of a couple people saying works well for them. So often it's good to start with a demulcent. Of course, anyone can react to anything. So don't take this as, naturopathic medical advice. This is not for everyone, but this is what I do so much of the time that I would say it's one of my top grandma medicines, just foundational, something you use all the time. And I would say overall quite safe. I think maybe one patient of mine has had a kind of sensitivity to slippery elm, which is a bark of a tree. So right, there could be some sensitivity issue there, which demands further investigation, to be honest. Because if you can't handle demulcent, you got some other problems. But yeah, there's tons of ways in which you could use demulcents. I guess I think of the gastrointestinal tract primarily, but urinary tract, and sometimes people would find them useful for soothing the lungs. So kind of like a supportive care for respiratory or issues with the lungs. Okay, so that's it for today's clinical bite. I hope that you can take this and integrate it with your naturopathic doctor or your doctor, and it's helpful for you clinicians out there too. Okay, so until next time, talk to you later.